Welcome to the Canadian CdLS Foundation podcast, where we explore, learn, and share everything related to CdLS. Now, we'll be talking with clinicians, families, and those exploring new frontiers to bring relevant content to Canadians impacted by CdLS. So if you have any suggestions or ideas of individuals you'd like to have on the show, please reach out at CanadianCdLSFoundation.com in the chat button. Just a quick disclaimer. This is not intended to be medical advice, and each individual with CdLS is unique, and therefore their individual care team or education team should be consulted. If you'd like more information or need support, please reach out to us at support@CanadianCdLSFoundation.com.
Hi, I'm Dr. Peggy. I'm a pediatric gastroenterologist at the Hospital for Sick Children, or Sick Kids as we like to call it, in Toronto. And I'm here today with Ms. Kelsey Gallagher, who's a dietitian here, who's been in many services over her time here. And we're both here to talk to you today about the why and how of blenderized tube-feed diets, particularly because today we're focusing on children and adults with chlamydia delaying, how they be used in these people, but also this is applicable to anybody who's got a G-tube and needs it for nutrition. Neither of us have any conflicts of interest. So I guess the first question as we're getting into this talk is just to make sure everybody really knows what we're talking about, which is what are blenderized tube feeds, and then why and how can you go about doing these. So basically, blenderized tube feeds are when you puree whole foods and liquids and administer them through a G-tube. Very simple. You can either do this by making your own food at home, or there are commercially available products which could provide all of the nutrition that somebody needs, or, for example, be a substitute for a meal, so provide part of the nutrition that somebody needs. So a blenderized diet. Why and how? Well, how did we get into this? Well, we had lots of families with children who had G-tubes in place, and they were asking about running real food into the tube rather than a commercial formula. And this was for many reasons. Some people thought that it was healthier or more natural to use real food. Many families felt that it actually allowed them to participate more in the nutrition and the feeding of their child, and this was very important. There were suggestions on many blog sites, particularly, and from families, saying that people felt better when they used real food as opposed to commercial formula, and this helped with things like reflux symptoms and gas. And me, being kind of naive, said, sure, why not? What would we suggest these children and adults eat if they didn't need to eat that through a tube, and then can we just give it through the tube? And lastly, there's been many stories that our microbiome, or the bacteria that live in our gut, actually like some variety in their diet. And the same old every day really didn't provide this. But families said they often had a lot of pushback from providing or using blenderized or pureed foods through the G-tube. That they were told, particularly by their healthcare providers, that this wasn't as healthy as a formula that somebody had spent a lot of time putting together, making sure it had all the appropriate nutrients. That there would be contamination due to cooking and storage. That feeding people with a G-tube, you really needed to be very exact about the nutrient intake. And lastly, there was a feeling of fear and loss of control, I think a large part by the healthcare providers and not so much by the families. So then we needed to say, well, is there some evidence that actually giving a blenderized diet might be better for people than just using standardized formula? So we needed to rethink all those pushback questions. So though there were lots of reports just about experience and how to do this, there really wasn't any data on how effective these feeds were. So the first study that was published was actually in 2011, and This is from Cincinnati Children's, and they looked at switching children who were dependent on a G-tube for nutrition and had a surgery for reflux and were having problems with gas flow after that surgery onto a blenderized diet and off of commercial food. And lo and behold, those kids were much better. So then we at Sick Kids decided to look at how feasible is it to do a blenderized diet. Does it work? Can families do it? And what effect does it have on their health and on their microbiome? And then lastly, there's a more recent report from the Boston Children's looking at the effect of blenderized diet. And now we're seeing more and more things come out in the literature. So from our study, we definitely found that using blenderized tube feeds was very feasible. And we looked at doing this by families making their own meals and pureeing them. We did see improvement in GI symptoms, even when families only managed to do partial blenderized feed. And we looked specifically at the gut microbiome, which is the flora in your GI tract, and we saw a significant increase in diversity and in the richness of the flora. And this is much better for your overall health. And lastly, we looked at nutritional composition, and it was just as nutritious as any of the formulas, and definitely caregivers felt an increased satisfaction with the G-tube feed. And in fact, in a different study, when we looked at how the families in our complex care program felt, they said it was the one thing in their child's life who often had many medications, technology, that actually they had a choice in. They could decide what their child was having. So this is from the Boston study, and what they did is they just looked at their patients who were dependent on G-tubes for nutrition and looked at things like how often did they have to come in the hospital, how often did they have a respiratory infection, how many visits to the emergency room did they make, and how many were related to respiratory infections. And there was a significant difference for those who had switched over and were using pureed feeds through the G-tube. Again, supporting families' request at doing this as something that they felt made their child's life better. So who can do a blenderized tube feed diet? Well, really just about anyone who's dependent on a G-tube for their nutrition after the age of 1. When they're under the age of 1, then we would say you need to work with your healthcare provider and look at when you would normally be introducing purees into your baby's diet, and then you can look at giving those G-tube if it's not safe to give them orally. You can use it in children that are stable and on G-tube formula, and they can actually begin partial or work to full blenderized diet. A blenderized tube feed diet, though, is not meant to replace safe and oral feeding. It's used to supplement that. And if your child is underweight, then working with your dietitian, you can ensure good, safe weight gain. Sometimes we might even recommend it and suggest that you change from formula, particularly if someone has gas bloat after fundoplication or surgery for reflux. When you have symptoms of reflux, recurrent aspiration or irritability, often switching to a blenderized diet will help. It may minimize the amount of respiratory infections that you have and the number of hospital visits. So now that we've talked about why you might want to use a blenderized diet, let's talk about how you use a blenderized diet. And this is a picture of one of our Canadian CdLS families that is now having a picnic in the park. And as you can see, their little one is getting a blenderized lunch. I've also given you the link where, after our study, we have a nice report which talks about, from the healthcare perspective, what we felt, but also the family's comments after changing their children over to a blenderized diet. And in fact, the only patient that dropped out of our study happened to be a child with Cornelia de Lange, because halfway through the study, she had managed to switch over to all oral feeding. and so no longer needed to use her G2 for nutrition at all. And now I'm going to hand over to Kelsey, who's going to tell you how you can do a blend-rice diet.
Thanks, Peggy. As Dr. Mohan had mentioned, we both had the privilege of working with families and patients who transitioned to blend-rice tube feeds, both through the study and clinically, and it's really it's wonderful to see families who are able to sit in the park and do a blend-rice tube feed and the satisfaction that comes from that. Just going to go to my next slide. Sorry, for some reason it's not going to the next. Okay. So, wanting to go into a little bit about what should you consider before starting blend-rice tube feeds. So, just a note from personally, it's a really good time to think for your family, for the person who's starting blend-rice tube feeds. Are you interested? But also, is it the right time to start blend-rice tube feeds? Once you get going, blend-rice tube feeds are just like any other family meal. But initially, it does take a lot of additional thought, especially if your family member has been fed exclusively through a formula. Blending up the food does take a little bit more effort, and just making sure that you've got everything composed. So, we had one family who they just started their child in daycare, and we're trying to figure out how to do G2 feeds with that. And the mother had just gone back to work, and so she said, you know what, I'm going to wait a couple months and revisit it. So even if now is not the right time for you with blend-rice tube feeds, you might find that it's something that really is right for your family later down the line, so keep that in mind. And then also looking at, do I have the right resources for me? So, having access to a medical team and a dietitian who are well-versed in blend-rice tube feeds or have access to other healthcare providers who can kind of help guide them through for you is really helpful. They can help you create a blend-rice tube feed meal plan and let you know how to initiate, transition, and monitor children with blend-rice tube feeds. And then just keeping in mind that there are some additional added expenses that may creep up. Sometimes some of these things can be covered too, but for instance, formula, a lot of patients who are on formula in Canada might have coverage, and then having to buy all their food for their child might be different with the blend-rice tube feeds. So keeping that in mind, but blend-rice tube feeds do not cost any more than any other kind of regular diet would for another family member. So my slides don't seem to, oh, no, never mind. There we go. Okay, so once you've determined that and you've decided, I am interested in starting blend-rice tube feeds, but how do I start? So discussing it with your healthcare team is a great start, and speaking with your dietitian, and don't be afraid to kind of outline what your goals and objectives are of blend-rice tube feeds. The literature shows that people start blend-rice tube feeds for many different reasons. So really being clear as to why you think you're interested in blend is great, because it'll allow you to get the right plan for you, and your dietitian will be able to determine how to create your blend-rice tube feed schedule. So looking at the nuts and bolts of providing safe and effective blend-rice tube feeds, I'm going to take you through the kind of top 6 things. The first is looking at adhering to food safety guidelines. The second is ensuring your child is meeting their dietary needs. Ensuring you have the appropriate equipment to make and preserve blend-rice tube feeds. Avoiding food that might be more prone to blocking the G2. Monitoring for changes in your child's bowel movements to make sure that you're avoiding constipation, which can sometimes result a little bit in blend-rice tube feeds when you're trying to tweak it. And then lastly, being prepared to go away or traveling So looking at food safety as the number one, a recent study that was out, it's great it's come out to let us know our pureed blend-rice tea feeds. Is there any additional risk of foodborne illness? This was something that was a little bit controversial within the medical community, especially with patients that are immunocompromised. And what we found is that whether it's commercial formula, whether it's pureed baby food, whether it's blended table food, there was a very similar level of bacterial growth after it had been left out for certain periods of time. So really what that showed us is that blend-rice tea feeds are safe from a food safety perspective, and that the same rules that you would have for food safety for your own family that would be eating orally apply to your family member that's having G2 blend-rice tea feeds. So, the key message is not leaving your meat out for 4 hours before you're giving it your blend-rice tea feeds, but we also have additional tips on food safety at the end of the presentation for you. So looking at our second nuts and bolts, we're looking at ensuring nutritional adequacy, and this is really the job of your dietitian. And what they do is, they look at what is the past growth history of the patient, what are their estimated requirements and projected needs into the future. They also do a great job of looking at what are the macro and micronutrient requirements as well as the fluid requirements of your child. And the next slide here I'll show you. I'll show you how we do this at CdKids. So at CdKids we actually give you a diet prescription. We share this as well with other dietitians and healthcare providers. So it is something that you can have access to as well if it's of interest. And what we've tried to do here is balance where the dietitian can provide you with, you need to incorporate within 1 to 2 vegetables and fruits in the day, and 1 serving of meat and meat alternatives, and then we give it to the family to choose, well, what food is that? So if you're looking in the meat and alternatives section and you need to have at least 1 serving of it, maybe you're giving eggs one day, you're giving peanut butter the next day, you're giving salmon the next, so you're allowing a great variety of foods, but you're kind of getting the base structure of the nutrition that we're looking for. So that's an example of how we kind of fill things here at CdKids. But then also just looking at balancing the diet in general. So when we're looking at a balanced diet, you guys are familiar with down in the States, My Plate. And that's how we want you to think of blend as well. So you can see here we have a sample snack, some yogurt, granola, fruit. So it's filling 3 food groups. You've got your meal, it's a nice salmon, asparagus, rice, and milk. And we want you to think of that family meal and blend it all up. Peggy and I, Dr. Marcon and I have heard so many people who have been so satisfied saying, I did have spaghetti and meatballs and I was able to blend it and push it through. So while we do want to have a good structure of food to make sure your child's getting adequate nutrients, we also really want it to be a family affair and for you to feel like your child or family member is able to get the same food in the end that your whole family would get. We've heard from many families that they feel their child on blend-rice tea feeds actually eats much healthier than maybe their other 5-year-old in the home. And so there is a really great opportunity to provide wonderful nutrition through blends. And just looking at one other consideration though, we did find through our studies that you had to look a little bit at micronutrient considerations, specifically sodium, so salt. You don't need to add a lot. It sounds a little bit counterintuitive, but if you're not cooking with any salt, there does need to be a tiny bit of salt that's added to meet requirements, as this is important for growth for children. And so that's really when you're blending up whole foods, and so you're not kind of adding any additional. But if you are cooking up, say that spaghetti and meatballs, there'll be plenty of salt in there, so you don't need to really worry about it. So that's, again, something that a dietitian or your family physician or gastroenterologist can help you navigate. Additionally, D drops, just because of where we're located, we need additional D drops because we oftentimes don't get enough vitamin D from the sun alone to meet our requirements or from the food that we're eating. Looking at creating a schedule. So this is, again, what a dietitian will look through with you and see, what kind of formulation of blend-rice feeds do you want. So if you're currently doing all bolus feeds, or you're currently doing all continuous feeds, or a combination thereof, it doesn't matter. You can still incorporate blend in, but it might be incorporated in a slightly different way. So incorporating blend-rice feeds, just to note, if you are on continuous formula feeds right now, your healthcare providers will be trying to help you figure out how to get your blend-rice feeds into a bolus feed. And so when we say bolus, we mean in less than 2 hours, and a lot of that has to do with the food safety that we were talking about earlier. So once you've kind of seen how you want to incorporate it in the bolus format, that's when you decide whether or not you're going to partially do blend, where maybe it's a family meal, maybe it's dinner time. That's oftentimes one where people like to start with blend-rice feeds because it's a time the whole family is eating together, and you might have more time to make and prepare the blend-rice feeds as well. Or whether you're doing 100% blend-rice feeds. We found in our study that people saw benefit from both partially and fully transitioning to blend-rice feeds. So it really depends on what you feel is best for your family. But if you are transitioning fully to blend-rice feeds, there typically is a bit of a transition period. So just to keep that in mind. So looking at the next slide here, I'm just going to give you a sample schedule of what that might look like. And you can see here, if 25% of your calories is coming from blend-rice feeds, that might look like a family dinner, and then bolus formula top-ups at other times in the day. Similarly, if maybe you're on a continuous feed, but you really want to do most of your feeds through blend-rice feeds, oftentimes what I would do is transition the patient onto 3 bolus feeds of blend-rice feeds during the day, so kind of having your breakfast, lunch, and dinner. And then if they had a continuous overnight feed of formula running before, just keeping that on. And so your daytime is blends and your nighttime is formula. But as you can see here, it really, there are so many different ways to do it, and there's no right way. So you might try out a few different things before you come up across the schedule that really suits your needs. So now looking at the next thing that we really want to make sure that you're prepared with before you start blend-rice feeds is looking at the equipment that's required. So on to the next slide here. You'll see these are kind of the 3 things that you really want to make sure you have. The measuring cups, liquid measuring, and dry measuring cups. The reason why we want to make sure that you have those are so that when your dietitian is telling you kind of serving sizes that she's looking for, you're able to understand what that looks like before you put it in and blend it up. Sometimes once you blend it down, you're not sure how much you started with. So really understanding, especially in the beginning, how much is going into your blends is a really good thing. The second is a blender. So they say a high-powered blender, and in our experience, that has worked really well. So in our study, we had Vitamix blenders donated. They worked very well, but a number of different high-powered blenders, such as BlendTech, Ninja, NutriBullet, Magic Bullet, a lot of different ones work, and even a regular blender does work as well. Sometimes we just found that people would go through the motor of the blenders a little bit faster. faster if it wasn't the high-powered blender. So keeping that in mind, it's helpful when you're trying to blend up, because we don't want things to get stuck in the tube as it's going into, as you're syringe feeding it in. And then looking at saving, so a lot of people will do batch cooking with blend, or sometimes they'll blend with the meal too, but if you are batch cooking, oftentimes you want to, kind of like you might have done with baby food, where you're freezing it in ice cube trays or even those silicone muffin tins to kind of blend up meals. Ziploc bags, people have done that for the whole day, so they just have to take one of those out, defrost it in the fridge, and it's set to go. So knowing that those are handy, very handy to have on hand, and a little bit of freezer space too. So looking at the next slide, just looking at the equipment that you want for your G-tube, you can do blenderized tube feeds with both a back block and a Mickey button for a G-tube, so it can be either type. Syringes are really the method that we've liked to provide blenderized tube feeds in, because it's easy to fill up the food and then just push it in to the G-tube, and we found that 60 ml catheter tips as well as O-ring syringes worked very well. The quantity, whether it's 20 ml or 60 ml, is kind of more so up to you and what feels most comfortable, but to keep that in mind. So looking at the next slide, once you've blended everything up, what you're wanting to do is look at the consistency. So if it's too thick, you're going to have a lot of pressure when you're trying to push in blenderized tube feeds. And so we say aiming for a honey-like consistency is always a good idea. And then just making sure that you're testing your blenderized tube feeds to make sure you're not feeding your child something that's, say, boiling hot. So perfect example is you made an amazing pot of chili, you blended it up, but you forgot to cool it off, because it's just, you're not having kind of that, your mouth as that tester to say, oh wait, it's warm. So keeping in mind, just testing on your wrist is a really good place to make sure that you're not accidentally eating that's too warm for your child or family member. So the next thing, the next nut and bolt is really avoiding constipation. I skipped one. Last one is preventing blocked tubes. So with the administration, what we've tended to do, sometimes there's an oil requirement where we'll say, give a tablespoon of oil in the day. So I find it really helpful to fill up a little bit of oil ahead, administer that. It helps lubricate the syringe, and then you can fill up your blenderized tube feed and administer that. And sometimes people found it really helpful to just line up and have a few syringes all filled so that they were able to give the meal versus having to re-pull up and re-push with one syringe. So multiple syringes filled with your whole meal is a trick I learned from a family. And then thinking of it again like a meal. So eating a meal in 2 minutes, you may have a bit of a tummy ache. Thinking about pushing in a little bit of food, letting it rest, pushing in a little bit more food, letting it rest. So you may have a whole bolus meal that takes 10 to 30 minutes for your blenderized tube feed to go through. So now moving on to the next nut and bolt and looking at the prevention of constipation. We found this, it wasn't a significant finding in our study, but I did get a lot of anecdotal reporting in our study that stools were a little bit harder, and so we oftentimes had to manage with adding a little bit of prune juice or pears to help with it. But something else that we found when we analyzed the food that they were getting on formula versus the food they were getting with blenderized tube feeds was that they were getting 6.3 times more fiber in their diet. And fiber, we love it, it's great, but it can also sometimes constipate us. So one easy trick for transitioning was, I would say, hold off on transitioning onto whole grains for now. You're getting a lot of fiber through additional veggies and fruit that's being provided through blenderized tube feeds. So start with that as your additional fiber, and then you can slowly increase the whole grain fiber once you kind of get to know the balance and see how whether your family member is getting constipated. So looking at stool consistency and frequency are kind of the two biggest things. And then also monitoring for hydration. So sometimes we can get constipated if we don't have enough fluids. So monitoring urine color, urine output, so how many wet diapers are happening in the day, how many times is your family member peeing in the day. Those are good things to look at as well. And you may need to provide some additional water flushes. And then the last nut and bolt is it's kind of a fun one, and it's thinking about what do I do when I have limited kitchen access, so when I get out and about. So we've had lots of families on blenderized tube feeds they've gone camping, they've gone on trips, which I know a lot of us aren't doing right now. But you know, there's lots of places. Am I going to my child's being taken care of by somebody else who needs to be able to provide blenderized tube feeds? There's lots of scenarios you might get into where kitchen space is limited, but you can do blends as well, just as easily. It's just figuring out which is the right way for you. Really easy one I like to do is look at jarred baby food, because it doesn't go bad. You don't need a refrigerator. So you get stage 1 or 2, and then you just kind of mix those jarred baby foods together. So you might get, say, chicken, jarred baby food, and peas, and mix that together, and that's your meal. Dr. Markon also mentioned different formulas that are commercial, rather not formulas, but commercial blenderized tube feeds that are also okay at room temperature. So, for instance, complete pediatric might be something where you say, okay, for trips, that's what I'm going to be using. Other people said, you know what, no, I want to blend on the road, so I'm going to use a magic bullet, so they just bring a smaller travel blender. And then other people, depending on the length of time, just brought a cooler or an insulated lunch kit to store their pre-blended feeds in. Perfect. So we'll now hand it over to Peggy for the summary.
Okay, so we've hoped that we've shared with you some reasons why you might want to consider starting a blenderized diet through the G-tube in your child, or for those of you who are already doing this, why it's a good idea. And then also like how it is possible to do this. And we found, not only in our study, but in many other families who are doing this, that when they want it and it makes their child seem better, that there's a way to work it into the schedule, whether it's full blenderized diet or whether it's a partial one. That the nutritional composition can be excellent, comparable to any formula, and in fact, you probably need to use the same principles to feed the rest of your family. That it is important to have the support of your healthcare providers, and a dietitian is really important to get you started and to help you monitor. And we know that, not just from our experience, but what's now been published, is that blenderized tube feeds can improve GI symptoms, it can increase the diversity and the richness of your gut flora, and it really does give parent and caregivers increased satisfaction. We have, at the end, because this will be posted, there are some resources that you can use, as well as some fact tips about things like food safety. So at this point, we would be ready for the question and answer session.